How you doing? My name is Tom Wellman from Apex Orthopedic Rehab. We decided to do a little quick thing on my top 3 exercises for lower back pain and sciatica. Very common. I want to give you my top 3 just today. The first one we're going to talk about is standing lumbar extension. Okay? So if you're having back pain or sciatica going down the leg, you first want to stand, keep your feet about shoulder width apart, hands on your hips, and you're going to lean backwards, just to the point where you feel pressure and you can't move anymore, and then you're going to go back into the starting position, okay? This exercise, it's not uncommon to have pain at the very end of the motion, okay? As long as when you stop and you return to starting, it doesn't hurt more than it did at the start of it. Now, if you just have central lower back pain and it becomes more focal, good sign. Sometimes it reduces completely. If you have leg pain, let's say you have pain down the left side of your leg, and it starts moving up as you're doing the exercise, good sign. Bad sign is if you have lower back pain and you start getting irradiation down the leg. Okay, so that's a general rule of thumb. All right. Sometimes as it moves out of your leg, as you're doing this exercise, if it's the right exercise for you, like I said, these are the top 3, but it doesn't apply to everyone. If it starts going to your back, it's out of your leg and now into your back. Sometimes it actually feels worse. As long as it's moving up, that's a good sign. All right, so you're going to do this 10 times every 2 hours, and I want you to get up every 30 minutes just to get out of, if you're sitting at a computer or whatever, stand up after 30 minutes, even if you don't have pain. Okay, so let's go over it again. This is the first one. Hands on your hips, lean back as far as you can, pressure on, pressure off, hips forward, back forward. Some people that have some balance issues, I actually have them do it against a kitchen counter or like here in the clinic against the table. So if they feel like they're leaning so far, they feel unsteady, they can just shift to the counter if they have to. They shouldn't be leaning against the counter, but that's the one. So that's lumbar extension and standing. Typically my plus 50 population, which I'm approaching, has trouble, it really benefits from the standing version of this. My under 50 population with sciatica and lower back pain typically benefit from the next one I'm going to show you. Okay? So the one you're going to do is you're going to lie on the table, keep your feet a little wider, and you can put your hands right underneath your shoulders, like this. You're simply going to press up so you feel stretch in your lower back. Pause. I like to have you take a big breath and breathe out and relax, and then come back down. As you do that, you shouldn't be using the lower back muscles to raise your body. You really want your arms to do the work. So you're going to come all the way up, all the point where you feel a restriction. I've got good range of motion. Some people start out literally doing this and back down, here and back down. Same rule of thumb. If you have leg pain and it starts moving up, good sign. I have back pain and no leg pain, starts moving down, bad sign, stop the exercise. Okay? This should not make you feel worse. So let's go over it. We're going to do a series of 10. Pressure on, breathe in, breathe out. Relax, you kind of let it sag, and then back down. So all the way up, relax, breathe in, breathe out. You'll feel like you get a little extra if you have a couple pause for a couple seconds. And then back down, all right? Series of 10 times every 2 to 3 hours, okay? So this exercise is to reduce your pain. Some exercises you'll find in therapy and such, you actually will feel worse before you feel better. This one, within a couple minutes of doing it, you should feel better if it's the right exercise. It should definitely not, it shouldn't make you feel worse, okay? So keep that in mind, and that's the safety in the system. It's not uncommon at the very top of the motion, when I was coming up on that push-up, to feel pain at the top. I would say half the patients feel that, and they get a little nervous. As long as once they get off the table, standing, moving around, they feel better, it's okay. So use that as your guiding rule. Now, one of the exercises that my third favorite exercise for sciatica, lower back pain, also could be like numbness, tingling, different symptoms. It could be on both legs or one leg. Most commonly, if I have someone that doesn't seem to do well with these 2 versions of the exercise, and this is a short version. This is not the evaluation that we perform in the clinic. This is just kind of my top 3 and my most commonly prescribed. But when we give you an evaluation here, it's really taking through a bunch of movements and see what one movement will reduce or eliminate your exercise. Okay, so just understand that when we do it. So anyway, so my third exercise, which you almost never see, unless you're a therapist or have been to therapy, is one I'm going to show you here. And typically it's with people that have pain just on one side. They'll say, Tom, I don't have pain down both sides of the leg. I either have pain on one side of the back, one side more, exclusively, or down the leg. Okay? So you're going to do it in standing. I'm going to stand up. Now let's imagine that, I'm just giving you an example, I have pain down my left side, okay? The painful side should be always away from the wall. So you're going to place your hand against the wall. And if you're standing, you're going to be a little offset. So you feel a little pressure to go in this direction. So you're going to take your hand, you're going to apply pressure this way, okay? Straight, so at your waist, pressure on, pressure off. What you don't want to do is bend this elbow, because then we don't get all the motion occurring from the hips and the lower back. So you're going to apply pressure on and pressure off 10 times. And then release it. For all these exercises, then you walk around a little bit. See how it feels, okay? Just like I said, you sometimes will feel more pain as you're doing it, but once you stop, it should feel better, at least not worse, okay? So that's an important thing to keep in mind. You want to do this exercise 10 times every 2 hours. That's my general recommendation. Hardest thing is remembering sometimes. That, and like we said earlier, don't sit more than 30 minutes. There's parts of your spine that don't have a great nerve supply, so you don't feel that you're kind of irritating your back until you get up out of the chair and you have the problem. Sometimes you feel it in the chair or when you're sitting, and sitting is one of the big triggers for lower back pain. So I would say it's 10 times every 2 hours. You should steadily feel better. If you do this for 2 or 3 days and you don't notice a difference, it may not be the right exercise for you. And there's other versions of exercises that I could show you, or movements. And sometimes you need hands-on care to kind of facilitate the movement. I'll help people with this stretch. I'll actually do a standing version. I'll give them a little extra push and stretch, moving into the side bend position, or I'll help them with that arch that I described earlier. But try these 3 and see if it is. It's really distracting having pain, especially when you're working and all that. It kind of takes away from your quality. It makes things last a little longer, take a little longer to focus. So try these 3, and wish you well with it. Any other questions, you can always call the clinic and talk to me about it if you like. All right. Listen, best of luck. I hope this helps you out. Just remember, it should not be. Your back pain and sciatica shouldn't get worse from doing this. I can't say that enough. Okay. Good luck and have a great Thursday.